Thank you for watching Dialogues in Dying, which we hope will encourage you to reflect on the way that difficult conversations about death and loss can be managed. While you might recognise some of the staff in the following clips, the scenes are role-played and have been constructed to promote discussion about language. While we chose motor neuron disease for our patient's journey, the issues that arise through conversation are generic to other roles and specialities. When you watch, try to focus on the interactions rather than the clinical context. This video is not about communication skills, but about the reservations that staff may have about using them in practice. When you watch, think about the implications for the patient, carer and health professional of having or not having discussions about death. We join our patient Jerry, part way into the consultation, so he has already been introduced to his consultant and specialist nurse. Here and elsewhere we have not featured the clinical information giving and explanation of the disease that of course takes place. Excerpts from the consultation have been chosen to focus specifically on those elements of dialogue that present a different type of challenge.
Do you deal with many people like this?
We do here, yes, and we're a big centre here. If I tell you that we've seen over 600 people with MND here in the last few years,
Right.
we're a very large centre.
Right.
It is rare. I don't know if you've come across many people who know what it is.
Not really. I mean, they gave me a letter that I'd got to give to my GP at the hospital, and when I took it to him, he didn't really know anything about it, which is well, a bit concerning, isn't it?
We'll make sure that we copy all the information to your GP, and if you remember nothing else about today, just remember that you, Sarah and me, we're in this to help you and to get you through this,
Right.
and to get you to live well with MND, and we'll include your GP in that, in that group of people too.
Right.
It's good to have a link with your GP.
Yeah, before you go home today, I'll give you my contact details and we'll pop them in the folder for you.
Okay.
So that after this consultation, if you've got any questions at all, you can always give me a ring and we can run through things again with you, just so you...
Okay, thank you. And so I can just call you when I've got a question.
Yeah, and I can always pop out and see you at home if you're worried about anything.
Right.
You get the full works here. So,
Okay.
so it's 360-degree treatment.
Oh, blimey.
Can I just go over? I know I've got the notes from the ward. Can I just go over your history? When were you last quite well? When was the electrical tests confirm that it is a problem with the motor nerves? And you had several blood tests here that I can see listed, because sometimes there are other disorders that can look a bit like motor neuron disease, and it's important that we make sure that none of those are going on. And looking through here, I really think that yes, all those other tests have been done, and I think the diagnosis is quite clear that it is motor neuron disease. And that's often a thing that people, when they come to clinic here, I so wish that I could tell you it was something else, something that I could give you a prescription for tablets that were going to make it better.
Yeah.
But I think it is this disorder of MND. Did they mention anything about prognosis or what's likely to happen?
Well, they talked about it, but yeah, they did. Yeah.
You said earlier on that your girlfriend's outside. Do you think we should get her in? Because if we talk about all these things, you're going to remember less than half of what I say to you today.
Okay.
Do you think we should go and get her and bring her in so we can talk about this?
Well, I'll ask her if she wants to come in. Yeah.
Okay.
Okay.
Thanks. I think that would be good.
Right.
Hello. Thank you for coming in.
This is Isha.
Isha.
Yes.
Can I call you Isha?
Yes,
Is that
yes.
fine? Actually, Mr. Wilson, can I call you Jerry? Do you mind?
Yeah.
that-
Everyone else does.
Fine. No. Okay.
Call me worse.
So thanks for coming in, Isha. This is Sarah, who's our motor neuron disease nurse.
Okay.
And I'm here as well running the clinic where we deal with people with disorders of the nerves that work muscles. And I was just going over with Jerry here his time on the ward, the various tests that he had, particularly the electrical tests in relation to his history, and looking through all the blood tests as well, saying that unfortunately I think the diagnosis is confirmed as being motor neuron disease, MND for short. And I was just talking about the fact that all the other tests for disorders that can mimic it, have symptoms a bit like that, seem to have been excluded here, and I think that is what we're working with.
It's definitely not anything else.
No, I think it is motor neuron disease.
And you're sure of that?
Yes, as sure as we can be. Motor neuron disease, well, let me tell you a bit about it. It's a disorder of the nerves that work muscles.
Right, so that's what you mean by getting worse over time?
Yes, and it's important that we get this diagnosis right, because as I think they'll have mentioned to you on the ward, and as you'll have read in the book there, MND is a disorder that gets worse, and it's a disorder that people die from. So the MND causes people to die rather than giving them a chance to die from something else. So the prognosis in MND is not good.
So I'm going to die, basically. That's what you're saying. This is going to kill me.
That is true. People with MND die because of their motor neuron disease.
There is nothing that you can do about it.
There are some things that we can do, and
so
can I just come back to it? When I'm saying that you're going to die from this, you know, is that next year? Is it 10 years away? The average survival, once this diagnosis has been made, is less than 5 years. But that's an average figure. We are all different.
Well,
but it's important that I think we give you that realistic prognosis of...
And this is definitely what happens to everyone that has this.
With motor neuron disease, everybody is different in terms of how quickly they get weaker. So, Jerry, you've weakness in your leg, and the chances are over the next few years you'll get weakness in the other leg, weakness in your arms, weakness in your hands, and eventually it's weakness in the muscles of breathing, and that's how people with MND die.
So, what happens next?
Well, at the moment you've got weakness in your leg, and particularly around the ankle there, and the chances are that over time your leg will get weaker, it will spread to involve your other foot and leg getting weaker, and then maybe your arms and hands, and eventually it might interfere with the muscles of breathing.
Right.
Right. Okay.
So that means, so is that how I would die then? Not being able to breathe?
Well, it's actually a big question about how people with this disease do die, but yes, most people die because their breathing muscles aren't working sufficiently. We'll talk about this over the months and years that I see you.
When you say months and years, I mean, how long does Jerry have?
That's such a difficult question to answer, but it's important, and most people with motor neuron disease are dead within 5 years of the diagnosis being made. So 5 Christmases from now. But that's an average figure, and none of us is average. We all have our quirks, so some people, the disease, yes, will go faster than that.
Well, that can't be right, can it really?
I think it is right.
So
and
you're saying that we have 5 Christmases together, that's what you're saying?
I think it's important that somebody who has seen lots of people with this diagnosis tells you what the average survival is.
Look at Stephen Hawking, so.
Absolutely. Look at Stephen Hawking.
do.
Even if they're 10, 15 years down the line, they lose all of their ability to function. Is that what you're saying?
A lot of the people who live with MND for a long time have very weak arms and legs, but it's the respiratory function that keeps them alive.
And what's the quality of life like then?
Well, what is any of our quality of life?
No, but
Really?
what is my quality of life going to be like?
Think about it. When you went into hospital with a weak leg, you had a weak leg. When you came out, you had a weak leg and a diagnosis of motor neuron disease. But your symptoms were still just that weak leg. Now, I think it's important that you know that I believe you have MND.
Yeah,
We've done
when
the
I went into
tests.
hospital with a weak leg, I went into a hospital with a weak leg. I wasn't going into hospital expecting to die, was I?
No, and I haven't said that you're going to die imminently. But
Well,
I
5 years
do,
is pretty
I
imminent,
do
isn't it?
think that you ought to know the average figures. And I'm not saying that to be cruel, I'm saying that to be realistic so that you can plan. If you want to go round the world on that cruise, do it now. If you've got big things planned that you were thinking of doing in the next few years, do them now. Right your wrongs with people you love, people who are close to you. Things like making a will, I know it sounds morbid, but those sorts of things are all sorts of things that, yes, I think it's realistic for you to consider.
What we're talking about is, by keeping myself active, would that prolong my life? That's the question.
It won't prolong your life, it will make you feel better, it will make your joints keep supple, and it's what you do just because you've now got this label. As far as possible, carry on and do that. You are still the same you, although you've got this label of the disease hanging over you.
It's not just a label, is it?
It's actually a disease.
It's actually a way of living that is going to affect the way that
Sure.
he lives at the moment. And
Sure, it's not just a label, and you know, I'm sorry that I used that term, but I mean by that you are still the same you inside.
And I'm going to end up stuck in a wheelchair, not being able to do anything.
I don't know. Not everyone ends up in a wheelchair, unable to move or unable to speak, like it's depicted on the TV when you've seen Diane Prissy and patients like that. Everyone is totally different.
Right.
So the symptoms depend on you as an individual.
And so how will I end up then? I was just thinking about, well, how do you broach it? How do I tell mum and dad that I'm, going to die before them?
Sure. And I think there is no easy way, and we can't prescribe a way that you do that. That is tough.
so you're saying it's not painful physically, maybe, but emotionally it's going to be painful, isn't it?
Sure.
Emotionally, it's going to
Okay.
be like
Pretty
dying a
crippling,
slow
really.
death,
Yeah.
basically, isn't it?
Emotionally, this is a very tough disease to have. And I'm not kidding you there, but I can tell you that we are here to be with you through this disease,
And what can you
to
do then?
help you with symptoms, to be alongside you, and to give you a good life and then a good death.
A good death is a difficult concept to articulate and has different meanings for different patients. We will return to end-of-life issues later,